Welcome to today's press briefing on the updates of COVID-19 cases. The speakers today are Dr. Libby Lee, Undersecretary for Health, Dr. Albert Au, Principal Medical and Health Officer of the Communicable Disease Branch of the CHP, and Dr. Larry Lee, Chief Manager, Integrated Clinical Services of the HA. Now, Dr. Libby Lee will give us some opening remarks. Good afternoon. First of all, on the adjustment of the vaccine pass program, and then I would give the floor to Dr. Larry Lee to update you on the HA situation, and then Dr. Albert Au on the new cases. Now, the epidemic has reached a dire situation recently. Since the fifth wave, 38 children between the age of 3 and 11 have experienced severe or even critical conditions because of COVID. Among the 38 children, 31 were never vaccinated with COVID vaccines. 4 children only received 1 dose. During the period, 8 children have passed away because of COVID infection. They were not fully vaccinated with 2 doses. At the same time, there are sufficient evidence showing that for adults who have received 3 doses of vaccine, after contracting COVID, the mortality rate would be much lower than those who are not fully vaccinated. According to the latest research conducted by the University of Hong Kong, no matter it is Comirnaty, BioNTech, or CoronaVac, if you are vaccinated with 3 doses, the protection against severe illnesses or mortality would be 90%. As a result, the government will adjust the vaccine pass in 2 aspects. First, lowering the eligible age for vaccine pass to children between 5 and 11 years of age. Second, for those above age 12, we would adjust the vaccine pass requirements for them. For children aged 5 to 11, we will adjust the vaccine pass in 2 phases. For the first phase, it will begin from the 30th of September. Children aged 5 to 11 are required to have received at least the first dose within 3 months to comply with the vaccination requirements under the vaccine pass for entering specified premises. If they received their first dose 3 months ago or earlier, they are required to receive the second dose in order to continue to be eligible for using the vaccine pass. The second phase will begin on the 30th of November. Children aged 5 to 11 are required to receive 2 doses of vaccination. At present, the first dose percentage of children aged 5 to 11 has reached 83%. For 2 doses, it is 70%. In other words, only 68,000 children between the age of 5 and 11 have not received their first dose. So we appeal to parents, please arrange for vaccination for your children soon. Under the new requirements and the new arrangements, children aged 5 to 11 who have recovered from COVID-19, the vaccination requirements will follow that currently applicable to recovered persons aged 12 or above. Second, on the adjustments of the vaccination requirements applicable to persons aged 12 or above, there will also be 2 phases. The first phase, similarly, will start from the 30th of September. For persons aged, the grace period for persons aged 12 or above to receive the 3rd dose after the 2nd dose will be shortened from the original 6 months to 5 months. In other words, for those who had received the 2nd dose within 5 months, your vaccine pass is still valid. However, if it is beyond 5 months when you got the 2nd dose, say at 6 months, then you will have to get the 3rd dose to continue to be eligible. The second phase will begin on the 30th of November. All persons aged 12 or above are required to have all 3 doses. The aforesaid adjustments do not affect the vaccination requirements applicable to recovered persons under the vaccine pass. We understand that parents are concerned that for children who do not have a smartphone, they cannot be eligible for the vaccine pass. Well, similar to the elderly persons, Children can make use of paper-based certificates or print out a screenshot to be eligible under the vaccine pass. And also through the eHealth app, parents can check their own and their children's vaccine pass status. Besides, it will introduce the new function to the Leave Home Safe app. The new function is that parents' Leave Home Safe app can store and show the vaccine pass of their children. We will make further announcements when the function is available. Lastly, with the global widespread usage of COVID vaccination, there are more and more empirical and clinical data showing the safety, quality, and efficacy of vaccines. Concerning the two vaccines we have in Hong Kong, that is Comirnaty and CoronaVac, that is BioNTech and Sinovac. Overseas, there are more than there are hundreds of millions of people who have received the vaccines. According to experience, both vaccines are efficient in reducing the risk of severe illnesses or death after contracting COVID. As at 4th of November, in Hong Kong, the public has received a total of 18.7 million doses of vaccines. The Department of Health only received untoward or adverse events after immunization to the percentage of 0.04%. Now, the COVID-19 vaccines adverse events incidence rate is similar to that of influenza vaccines or infant vaccinations. In the UK, the US, and Australia, the governments at these places have regularized the usage of vaccination for COVID. It is evidence that there is sufficient data and evidence that the vaccines are safe and of quality. Tomorrow, the government will publish on the Gazette the amended requirements under Cap 599K. Now, for those vaccines which are allowed for emergency use under 599K, if there are sufficient empirical and clinical data, the vaccine producers can register under Cap 138A. In other words, from data overseas and in Hong Kong, we can see that the safety, quality, and efficacy of vaccines are ensured. So parents should not hesitate to get yourself and your children vaccinated. So that's all for my report today. I would give the floor to Dr. Larry Lee. Good afternoon. There are 2,790 inpatients under the HJ, with 315 being new patients. 502 patients are in isolation ward. 191 are in Tier 2 wards. 594 patients are in the North Lantau Infection Control Center. 231 patients are receiving treatments in AWE. Among them, 218 are new patients. Yesterday, we reported 7 patients in critical condition, 11 serious. Among the inpatients, 48 are in critical and 39 are serious patients. 14 critical patients are now receiving treatments in ICU. Concerning death, we have reported 11 deaths, 6 males and 5 females, aged between 68 and 101. 8 deceased patients have not been fully vaccinated with 3 doses. For care home case, we have 1. Among the deceased patients today, most of them were not vaccinated. Once again, I appeal to the public, especially for elderly people and vulnerable people. You have higher risk to experience a serious illness and mortality. Please get vaccinated.
Earlier on, the government has already announced that the age of vaccination has been lowered to 50, that is for those who would like to take the fourth jab. So for those who have this need, we would encourage them to take the fourth jab. And there are 9 cases which are related to COVID, and also 2 cases that are not that closely related to COVID. The first involved an 88-year-old female. Well, she has taken 3 jabs, and she was admitted to the hospital at Chin Shui Wai, and she was having a high fever, and she was admitted to the A&E department, and 2 days earlier she was tested positive, and so on the day of admission, she was also tested positive, and her condition deteriorated, and she passed away on the 6th of September. 84-year-old female, having taken 3 jabs, and she was a diabetes sufferer, and she was admitted via the A&E department at Nethersoul Hospital, and she was also tested positive for PCR, and she passed away on the 7th of September. 68-year-old male. She was from an elderly home, and she had 2 jabs, and she had diabetes and high blood pressure, and she was isolated in the AWE. But then subsequently, because he was suffering from shortness of breath, and also the oxygen level was low in his blood, and he was admitted to the North Lantau Hospital, and then he was tested positive on RAT, and then he passed away on the 7th of September. Another 93-year-old male. There was no record of vaccination, and he was a cancer sufferer, and he was admitted via the A&E department of QEH. He was having a fever, and he was coughing, and he was also tested positive 4 days before his death. That was RAT, and he was also suffering from shortness of breath. At the day of admission, he was tested positive on PCR, and he passed away on the 7th of September. Another one, 85-year-old male with 2 jabs. He also had this cardio condition, and he was admitted to the Chin Shui Wai Hospital, and he was tested positive both on RAT and PCR, and his condition was deteriorating. He was admitted to Port Oi, and he passed away on the 7th of September. 69-year-old male, no vaccination record, and he was admitted via the Caritas Hospital A&E department. He was vomiting, and he was tested positive, and his blood oxygen and also his breathing was very poor, and his condition deteriorated and passed away on the 7th of September. 99-year-old male, no vaccination record. He had a stroke beforehand, and he was admitted via the QEH, and he was having a fever, and he was also tested positive on RAT, and PCR test was also positive, and in the afternoon of September the 7th, he passed away. And 71-year-old female with 2 jabs, and he was admitted by the Caritas United Christian Hospital, and his overall condition was poor. He was suffering from pneumonia, and blood oxygen was poor. He passed away on the 7th of September. 70-year-old female, and with 2 jabs. She was also having a very poor lung condition, and he was admitted to OCH, and RAT tested positive, PCR also positive, and also on the 7th of September she passed away. Last, the 10th and the 11th, we believe that they were not directly related to COVID. The 10th patient was an 81-year-old male with 3 jabs. He was suffering from terminal lung cancer, and he was admitted via Yan Chai Hospital. He was suffering from shortness of breath, and he was also having this terminal lung cancer, and he was also having a pneumonic edema. He passed away on the 7th of September. 101-year-old female, no record of vaccination. He was admitted via Kwong Wai Hospital A&E department. She was having abdominal pain, and she was found to have this edema in her abdomen and so on, and therefore she passed away on the 7th of September, probably having to do with cancer. And 384 patients recovered, and 339 were discharged, and 4 were classified as close contacts, and 176 staff members of HA were newly added confirmed cases, and 75 have also returned to work. And then QMH and also the geriatric ward, an 80-year-old female patient. She was found positive on the 7th of September. We conducted a tracking study, and we noticed that 3 patients aged from 21 to 91 female who might be classified close contacts, and 1 was in critical condition, and 3 others were in stable condition. And the ward has already ceased visiting arrangements, and it's been comprehensively sanitized, and patients and staff have also got to be tested. With regard to designated clinics and also general clinics, would also have to have some adjustments because of the COVID situation. Starting from tomorrow, that is the 9th of September, 1 more designated clinic will be designated. So instead of having 7, we're going to have 8 in order to enhance our service. With the newly added clinic that's in Kowloon City, that's the Central Kowloon Clinic, and starting from tomorrow, general outpatient service will be suspended. And then for patients and their carers and family members can also make appointments via the HA Go and also the mobile apps, and they can also use the remote consultation service, and also they can also make appointments to see the doctor at the designated clinics and so on. And starting from tomorrow, the general GOPC would also adjust its services so that for the general consultation hours that would be shortened. With regard to the details, via our press release, we have already given the details, and I'm sure you have already got them. And we will continue to monitor the situation with regard to service demands because the school term has just started, and also after the long holidays, we might need to make further adjustments. That's all I'd like to say so far. Thank you. Yes, Dr. Au. Well, as at yesterday, that is the 7th of September, I'd like to report the latest situation. Well, as said yesterday, 10,910 cases have been reported. 2,825 were directly tested positive via PCR, and then 8,085 were RAT tests positive, and then 181 were imported cases. 167 were tested at the were on RAT at the airport, and 14 were subsequent cases, and then there were also 12 new cases, and a total of 9,556 death cases were recorded. And out of the 12 death cases, other than the 11 cases reported by Dr. Lee, we also reported from the mortuary 1 further case. That's a 71-year-old male having 3 jabs, and he's been living alone, and he was also having other chronic illnesses, for example, pneumonic edema, and also renal failure, and so on. And on the 1st of September, he was found fainted at home, and then subsequently he was certified death. And then after samples were taken, well, RAT test was positive, and then on the 5th of September, PCR test was also positive. So we'd like to call upon the public that if you have any symptoms, you will have to seek help immediately. You will have to go to see a doctor. And if at present, the Joint Experts Committee under the DFH is recommending that for those aged over 50, they should take the 4th jab. And the latest for mortality rate is that out of those over the age of 60, the expert committee is recommending that they should take the 4th dose. And for those with chronic illnesses, the mortality rate is 7.76%. And for those who have taken the 1st jab, the mortality rate would be lowered to 2.52, and then for those with 2 jabs, 0.67, and then for those with 3 jabs, it would be 0.15%. So it's a 52 times difference, and therefore for those who have taken the 4th jab, for those over the age of 60, the mortality rate would be further lowered to 0.04%. So when compared to those who have not taken any jab, that would be a difference of 194 times. And then out of the 181 imported cases, 64 were found at the airport, and then 75 were found at the quarantine hotel or at the community testing center. And then for the remaining 42, they were tested positive at the community testing center. And 34 were found during the 4th to 7th day, and then 8 were found after the 7th day. So the CT value was relatively high, probably a repositive case, and 42 cases were from some different countries, and 6 with more than 10 cases, including UK, Philippines, US, and also Thailand. And then for the remaining countries, they have imported a total of less than 10 cases.
There were 5 care homes reporting infection yesterday, including 3 RCHE with 11 residents and 2 staff members, and 2 RC residential care home for people with disability with 5 residents infected. For the 5 care homes, there are 146 residents defined as close contacts and required to undergo quarantine. They are the Wan Gien comprehensive elderly care home in Chuen Wan with 8 residents infected and 1 staff infected. 73 residents are close contacts. The second one, Sun Chongling elderly care home in Kwun Tong, 1 resident infected, 3 residents close contacts. The third one is in Yau Chim Wong, the Christian Sun Yi Hui Yan Hai Gui care home. 2 residents and 1 staff member are infected. 62 residents are classified as close contacts, and there are 2 residential care home for people with disabilities in the Southern District, Christian Youth Association home, and also in Kwun Tong, St. James Yuen Ming Gui. 1 resident infected with 3 close contacts. For schools, this morning we have received a total of 1,356 cases from schools this morning, including 163 cases. There are students and 193 teaching staff involving 770 schools, including 169 kindergartens, 316 primary schools, 287 secondary schools, and 17 special schools. Now, for schools with infection in the past 7 days, more than 2 cases, there were 584. 24 schools, 42 schools are advised to suspend certain classes because of outbreaks in classes. They involve 2 to 9 cases in each class with an average or the median figure of 3. Now, for subvariants concerning L452R strain samples, that is BA.4.5, the percentage was 69.5%, similar to that of the day before. BA.5 accounts for 62.5% of the total number of cases in Hong Kong. BA.4 6.95%. BA.2.1 2.1 12.7% at a standstill, and the remaining are BA.2, that is at 23.2%. Now we will take questions. Please identify the media organization, and we have a lot of reporters today, so please limit your questions to 3 and allow more reporters to speak. The gentleman in white. Good afternoon, doctors. I'm from Mingpao Daily. Now you're expanding the vaccine pass to more children. So why now? And what figures and indicators have you reviewed to reach that decision? Now the second phase will be in November. So do you expect the situation to continue to be worse? Now, can you give us the admission rates for children under the age of 5? Now, for recovered children or recovered persons, children who has never been infected has to undergo 2 doses. For those who are recovered patients, it seems that they will need to have 3 jabs in total. So why the difference? Why don't you require a standardized number of jabs as 2? Now, for LCSD venues or libraries, are they not covered under the vaccine pass? Why is the difference from the requirements for people aged 12 or above? Now, on the vaccine pass, maybe the HA can give us the figure on admission rates for children under 5. For recovered patients, I will invite Dr. Ao to supplement. Now, why now? Why we are expanding the vaccine pass program to children between 5 and 11? As I said in my opening remarks, in the fifth wave. For children, patients who were serious or critical, there were 38, and there were 8 child deaths. Of course, one serious or critical case or one death, one child death is too many. We want to avoid that, so we want parents to get their children vaccinated. Everyone would be saddened when you see a child get sick or even died. Everyone's life is precious, especially a child, and also the death of a child would cause immense and irreparable damage to a family. Since the vaccines are suitable for children, we want parents to take the opportunity to reduce the risk of infection for their children. So why 2 phases, and why the second phase would only start on the 30th of November? Well, we know it takes time to get 2 doses, and it depends on the kind of vaccine you choose. Now, the second phase will start on the 30th of November. The idea is to allow sufficient time for parents to get the second jab for their children. Now, for libraries, libraries are not a scheduled premise under the requirements. Still, libraries would follow the vaccine pass requirements and require a vaccine pass to enter. The idea is that there are many people visiting the libraries, and the infection risk is high. So we want children to protect themselves and other library users. So that's why we want them to be vaccinated to enter a library. So before they have got 2 doses, if they want to borrow books, their family members or friends can help. The idea is to get vaccinated soon so that they can resume normal life and go to the libraries to enjoy themselves. Now, Dr. Au, please. Dr. Lee. I don't have the full set of figures. Now, for children between the age of 0 and 11, there are 103 child patients in hospital. Now, the utilization rates for pediatric isolation bed is 60%. Now, for those under the age of 11, there are 1 critical patient and 2 serious patients. Well, we reported 5 children who had been in a critical or serious state. After our care, they turned stable. On recovered patients, the idea is for children aged between 5 and 11 who have been infected, 6 months after their recovery, they don't need the additional jab under the vaccine pass requirements. If they are beyond the 6 months, if they are after 6 months after recovery, they need to get the additional jab. If they are not, if they have not been infected, they need 1 jab under the vaccine pass. If it is already 6 months past their first jab, they need to get the second jab. For children who receive the first jab within 6 months, they don't need the additional jab. Now, if the first jab is BioNTech, for children aged 5 to 11, they don't need the second jab if the first jab is BioNTech. If they have been infected and it is 6 months after the recovery, they may still use the vaccine pass. Next question, please. The lady in beige. I'm from Cable News. Now, you are lowering the eligible age for vaccine pass to 5. There are groups who are worried that it would undermine the social development for children because they can't go out. Now, you said protection for children is of utmost importance. Now, would you expand the vaccine pass to schools in the future? Now, just now, the Undersecretary said for children between 5 to 11, the first jab rate is 80%, the second jab is 70%. So why do you still have to drive the vaccination for children. Now, why is there a grace period of 5 months for the second and the third jab? For children age 5 to 11, there are groups who are worried about undermining children's rights and the normal development of children.
From our perspective, we fully respect their rights, in particular for children. They also have the right to grow up healthily, and they also have the right to live. And therefore, on this point, we'd like to call upon parents and guardians to take their kids for vaccination so that they can return to normal life afterwards. Even if they go to places that are very crowded, they will still remain healthy. In particular, for children, when they are able to exercise their rights, that would very much depend on the adults and also their parents, and therefore we call upon parents to take their kids to receive vaccination. In particular, when it comes to serious and fatal cases, even one case would be one too many. And therefore, well, when a kid is in a family, if he's having any sickness or if he passes away, then the entire family will be devastated, and the trauma would be difficult to heal. In particular, just imagine, why would this child be infected with COVID? Probably the family will have a guilty conscience, and it would be hard for them to get over that kind of emotion. And therefore, we'd like the parents to think hard about this for your own children's benefit, and also for the children in the neighborhood. You should take them to receive the jab. And indeed, for schools, they have already taken measures, including the requirement that all children going to school will have to take the rapid test every morning. So I think schools have been very cautious and careful in order to check out whether or not the students have been infected. Which other question? Well, why do we have to shorten that grace period to 5 months? In fact, as Dr. Au explained just now, well, we have looked at different data. And for those who have taken the third jab, if is an adult, then the infection rate would be a lot less than those who have not taken the third jab. And therefore, we encourage all members of the public to take the third jab. It's not just about protecting yourself. If you have elderly member and also children, and also you would have elders and also children in the neighborhood, and therefore you're not just protecting yourself, but also those around you. And therefore, there are sufficient data to show that the vaccine is safe, and that would also help reduce the number of serious cases and also fatal cases. And therefore, we call upon you or members of the public to take the third jab as quickly as possible. An English question, please. Well, the one in the right.
I'd also like to follow up on this children's group that raised concerns about children's long-term development being affected because of this vaccine pass. So how is the government going to address concerns? Because parents are concerned about things like side effects and, their children being deprived of the right to go out for social activities or different things. Their need to leave them at home if their vaccine pass requirement is not fulfilled at the moment. And my second question is, can you give us an update on the government's negotiations and potential purchase of a BioNTech, children's version of BioNTech vaccine? Is there any expectation for parents that they can sometime in future, take their children for the BioNTech vaccine? And also, I'd also like to ask about the rationale in English for the shortening, the narrowing of the gap between the second and third dose of a vaccine. Thank you.
Okay, thank you for the question. I absolutely agree that a long-term, effect on the children when they are deprived of social contact or social activities or outdoor activities, that will actually affect their development. In order to basically normalize their daily lives so that to maximize their opportunities to go outdoor, to increase their social activities, I think the way out, at the same time to protect their health, the way out is actually bring them for vaccination. This is not only protecting your kids, it's also protecting your neighbor's kids. If we really want to actually have normalize our lifestyle for the kids and actually bring them out to see around, I will actually I would actually recommend everyone, basically the parents, bring their kids for vaccination to complete the whole course of 2 doses. Concerning about the BioNTech, the arrangement for the children vaccination, government is actually putting a lot of effort in negotiating the terms, and then when there are actually results, we actually basically would go out and announce. However, I will highly recommend the public don't wait for the vaccination or the BioNTech vaccination for the kids at this moment. The key is actually bring your children to vaccination as soon as possible. So basically, they can get their protection as soon as possible, and to reduce the side effects and also the quite severe cases, number of severe cases in the children population. So don't wait. We have vaccination now. Basically, just bring them for their own safety. For the gap, actually we are restricting the gap for the second dose and the third dose from 6 months to 5 months, based on the reason that because of lots of scientific data and also evidence to show that individuals who are infected by coronavirus, COVID-19, if they are covered by 3 doses of vaccination, their mortality rate, or actually the rate of becoming in serious conditions or actually critical conditions, the rate is much less than those without 3 doses of vaccination. And based on this evidence, we want to protect our public, we want to protect our loved ones. I would highly recommend that our populations go for the 3rd dose as soon as possible. So the introduction of reducing the number of months from 6 months to 5 months is basically hoping the public can get their 3rd dose as soon as possible.
So we'll take one more English question. The first one on the first row, yes.
Hi, South China Morning Post. Just now you mentioned to normalize the life of the residents in Hong Kong. So the marathon organizers said it won't accept anything less than 25,000 runners in November's marathon. So how is the negotiation going on? Has the number of runners finalized? And also about the Rugby 7, we don't have much details after the sport commissioner said he has confidence that it will go ahead on time. So what is the status of the sevens now? Would it be cancelled at the last minute? And is that a good idea, not letting the audience eat but allow them to drink? What will government do if positive cases are found in the audience? Do you have a plan for that scenario yet? Thank you.
Okay, so again, we hope to normalize our life as soon as possible. But whether we have these big events whether we actually implement these big events, depends on a lot of factors. One of the factors probably will be the number of positive cases, confirmed cases, but that is not enough. We still need to look at the real situation in Hong Kong around that time. For example, what variant that we have. Currently, we have the Omicron BA.5. And what is the reproductive rate, that is the infectious status, and how about the risk of actually inbound traveler? And we have a lot of things, and also, of course, the population vaccination rate. And we have a lot of things to consider. And with this basket of considerations, we are still actually actively negotiating and actually discussing how to carry it forward. Once we have confirmed everything, we will come and announce it, and hopefully by that time we can have a safe event held in Hong Kong. But that will depends on the situation of the pandemic here in Hong Kong.
Next question, the one in the second row, the one in green. Thank you. I'm from AM 730. Well, you talk about the vaccine pass, and then for children's vaccine pass, you can increase the quota. So to what extent are you going to increase that, and also shortening the period from 6 months to 5 months? So have you done any assessment? How many people will be affected? How many of them will have to take the 3rd jab earlier? And also you said that the children vaccination rate, you said that if they can take the jab, then they can return to normal life. So to what extent? So what kind of percentage do we have to achieve before they can go back to normal life? In particular at schools, in fact, the situation would be very similar to that in the community. So in terms of the risk at school, would that be similar to the community, and therefore should you be making further adjustments? And also you said that for children, they can use the paper record and also the QR code, but then some restaurants are refusing the paper-based vaccination record and so on. So can you once again call upon those restaurants and catering establishments that they should accept the paper-based record and also the snapshot of QR codes and so on, and also for the administrative premises and so on, would they be lowering the age as well?
Capacity.
On the capacity of our vaccination drive, every day we are closely monitoring the capacity of vaccination for each day. Before we announce the adjustments, we have a rough idea of how many people are still yet to get the third jab. For those between 5 and 11 of age, there are 68,000 people who have not received a single dose. So we have allowed for sufficient time for parents to get their children vaccinated. That's why we have two phases. On our targeted vaccination rate, well, from a public health perspective, of course, we would like the vaccination rate to be as high as possible. It's best if everyone in Hong Kong is vaccinated. In reality, we need to consider a basket of factors. Vaccination rate is just one of the factors. We need to keep an eye on the economic situation, the developments of the epidemic, the real-time productivity rates and other factors. So we can't just decide the whole picture on a single factor. We need to take a comprehensive consideration. Concerning the paper-based certificates, thanks for your question. It should be acceptable. Same for the QR code on the screen. We urge the businesses to allow people holding a paper-based certificates or QR code to enter the premises. Next question, please. The lady in blue. I'm from. So concerning administrative premises, including libraries, you said they would be included. Does it mean that all these premises would be included, including children, dental clinic, and so on? Now, on the vaccination for recovered children, you said that if 2 doses were received before infection, no additional jab is needed. For those who only receive 1 jab or 0 jab before infection, they need to get another jab. Why? Because we usually understand that infection is equivalent to 1 dose. On designated clinic, you said 1 more clinic would be opened. Why? What is the number of patients seeking help? How many of them opt for teleconsultation? And what is the amount of oral viral drugs prescribed? Dr. Larry Lee, thank you. On oral viral drug, as at the 5th of September, more than 80,000 patients have been prescribed with one of the 2 drugs. And private doctors have prescribed the drugs to more than 3,000 patients. Now, concerning the adjustments of service level of GOPC and designated clinics, between the 26th of August until now, the number of in-person patients has increased from 898 to 1,178. For teleconsultation, the number has increased from 857 to 1,051. The increase warrants expansion of services to offer adequate medical consultation services to patients, hence the adjustment. The situation is a bit different from hospitals. For designated clinics and GOPC, they are very effective for patients who can't go to hospitals or who are not very mobile. So it would certainly help the public. Concerning medical institutions, similar to adults. Hospitals and clinics are places where you seek medical assistance. So for children and adults who are not eligible under the vaccine pass requirements, they are still allowed to enter these premises to seek help. Well, for children aged between 5 and 11, it depends on whether your first jab was BioNTech or Sinovac. For BioNTech jabbers, you only need 2 doses. For Sinovac, according to the recommendation of our experts committee, 3 doses are required. So the question is, was the first jab Sinovac or BioNTech? Next question, please. The gentleman over there. I'm from Now TV. Concerning designated clinics. Now you said there are 1,000 patients seeking help. So is it at full capacity? So will one more designated clinic help? When will you open more designated clinics in the future? Now concerning the protection rates for children between 5 and 11, do you have the figure? Now some experts say this is a compulsory measure forcing children to get jabbed. What is your response? And would you consider other measures other than jabs? Dr. Lee? Now as the HA, according to the Department of Health as well, we don't have critical or serious pediatric patients. Now we have more than 100 inpatients in our hospital who are children. Please understand that just in last week, there was a point when we had 160 pediatric patients, and 5 pediatric patients had been at a critical condition. So concerning designated clinics and teleconsultation services, I don't have the data about the capacity. As said yesterday, there were 1,178 patients visiting the clinics themselves and 1,057 patients opting for teleconsultation. Now for these services, very importantly, we want to offer the consultation to patients as soon as possible. Time is critical. Now we want to prescribe patients with antiviral drugs. Delay is not ideal, so we want to be forward-looking in adjusting the service level. According to the change in the epidemic level, we will adjust the number of quota available. Now we have different phases in terms of deployment of beds, the AWE Infection Treatment Center, and also the Hong Kong Infection Control Center, and also Tier 5 support. We are going to deploy them flexibly. Concerning lowering the vaccine pass age to 5, well, we really want children between 5 and 11 to develop healthily, both mentally and physically. We want them to be able to go around and visit libraries and so on. But the fact is, there have been a lot of critical and death cases. No one wants to see children experiencing these conditions. So with a vaccine pass, we want parents to get their children jabbed so that they can exercise their rights and enjoy a normal life. Last 2 questions, please. The gentleman in the front and then the lady. Good afternoon. I'm from Hong Kong 01. Questions on the vaccine pass. Dr. Lee said this is an incentivized approach, but there are children because of different conditions, maybe a heart condition, they have not been jabbed yet. So do you think this measure is a punishment for parents and children who are not jabbed yet? You said that if you are jabbed, you can return to normal life. Does it mean that without a jab, their rights to a normal life would be deprived of? Now, For children aged between 5 and 11, the requirement is 2 jabs. So would you adjust the requirements to 3 jabs in the future? And also for Leave Home Safe, you said there would be an update. So when will the updates be available?
Finally, well, globally, there are many countries that have already lifted all the restrictions altogether. And still, we are implementing this vaccination pass. Are we going in opposite direction with the global trend? And as a result of that, will children be affected in terms of going back to normal life? Well, first, on the complications, whether or not they will be suffering from myocarditis and so on. Well, according to the data, whether it's local data or overseas data, well, you notice that when it comes to vaccination, whether it's adults or children, we can see that it's still relatively safe to take the jab, and our expert committee has been monitoring the situation closely with regard to the dosage and also the time gap in between doses in order to increase the safety of vaccination. So in that regard, I think the public can be rest assured because we have already given over 10 million jabs. As to whether or not they would be required to take the 3rd jab later on, well, rest assured, we haven't got the data yet. And before we implement any measure, we will have to have sufficient justifications and also data to back up that requirement. So at this juncture, I'm not in a position to answer whether or not there will be a requirement for the 3rd jab. With regard to the Leave Home Safe updating, that is to have this new function added. Well, for the details, they'll be announced later. I don't have the date yet, but then it should be done very shortly. With regard to converting with the global trend, well, relatively speaking, if you look at the number of jabs that have been given in Hong Kong, we are not the highest. Yes, we've been doing quite well. Well, overall speaking, for those who have taken the 1st jab, we have already reached 93%, and for those who have taken the 2nd jab, is already there's already 90%, and then the 3rd jab is only 70%. But then, if you look at the different age groups, well, there are certain age groups that are doing not that well. For example, for children, well, for those who have taken the 2nd jab, the percentage is not high, and therefore, given the circumstances, we'd like to protect the frail and the old. So we'd like them to be protected. Thank you. Last question, the one in black. Thank you. I'm .news. Well, I'd like to know, well, for serious cases and also fatal cases in children, that is rising. So will the government consider lowering the current vaccination age? So will that be lowered further to 3, for example? So that's the first question. And also, if they've been infected, so for those between 5 and 11, if they have already recovered, then what kind of requirement will be imposed on them when it comes to vaccination? So when compared to those 12 and above, well, for those recovered patients, will the requirement be the same? So that should be the same, right? Thirdly, well, for children receiving vaccination, there are only 4 vaccination centers. Will you consider increasing that number? And will arrangements be made so that there would be dedicated staff to do the vaccination? And also, will there be more hotlines for parents to make inquiries about vaccination for their children? Okay. So whether or not the age will be lowered to 3, and also for those who have recovered, the situation will be the same as those over 12. And then with regard to the other question, I'll defer to Dr. Au. With regard to whether or not it should be lowered to 3, it's a bit too early to say that. So we would take the first step so that it will be lowered to 5 first. And then for those over 6 months to 5 years, they can still receive the jab, and we would encourage our parents to take them to receive the vaccination. But then whether or not it should be lowered to age 3, we haven't taken a decision yet. Yes, Dr. Au? Well, for the number of hotlines, if parents have any questions about vaccination, they can still call up the hotline of the CHP, that is 1-830-111. Sorry, speaker is off mic. Well, can I ask the last question? Yes. I'm from the Economic Times. Which agency? Economic Times. Well, for those between 5 and 11, well, for vaccination pass, they would be required to have 2 jabs. But then you also said that, well, if they've been infected and if they've taken the first jab, they will still have to take the 3rd jab, because earlier on you did say that for Sinovac and also for BioNTech vaccination, they would only be required to take 2 jabs. So why is there this difference and change? Well, Dr. Au, can you give us more details about the guidelines? Well, the expert committee under the CHP said that for those aged between 5 and 11, in fact, there are 2 vaccines that they can choose. One is Sinovac, and if they have chosen Sinovac, then parents will have to make sure that they would take 3 jabs before they would be regarded as having completed the vaccination. That is, after the first jab, within the first month or 28 days later, they would take the 2nd jab, and then after 3 months, they would take the 3rd jab. On the other hand, if they choose to take the BioNTech jab for their children aged between 5 and 11, they would only require to take 2 jabs. After the first jab, after 8 weeks, they will take the 2nd jab. And the expert committee's recommendation is that after they've been infected, that would be treated as if they've taken 1 jab. So depending on the individual circumstances, that is, well, whether or not is before or after the infection that they have taken the jab. Generally speaking, if they've been infected, then if they choose to take Sinovac, or if they have already received Sinovac vaccination, then they would have to take 1 more jab. But then, if they are choosing BioNTech, then after their infection, then all they need to do is to take 1 jab. And scientific evidence shows that, well, after they have recovered, if they have not taken the jab, then after they have recovered, after 28 days, they can already take the 2nd jab. Okay, thank you. Meeting has ended. Thank you.